Thank you, Madam Speaker. Madam Speaker, yesterday Heidi Zenker wrote to me about her 29-year-old daughter, Cassidy. When Cassidy first sought help for her intense and life-altering pain, she was told it was normal. She was referred to the IWK in 2019, but still has not seen an OBGYN. Desperate to live a normal life, Cassidy sought help in 2023 in Maine and paid $60,000 out of pocket for an endometriosis diagnosis and surgery. MSI now won't reimburse because, quote, they treat endo in Nova Scotia, unquote. Cassidy is not alone. How is this acceptable?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker, and I thank the member opposite for the question. So we appreciate that there are a number of individuals who sometimes choose to seek health care outside of Nova Scotia. We do have a policy that was recently reviewed, and the qualifications in order to seek out-of-province care have been reviewed and updated. What we would say is that anyone who's considering care outside of Nova Scotia, please contact the Department of Health and Wellness first to better understand the pathway in order to do that. If it's at all possible, of course, we want to support Nova Scotians getting the care they need. We need to do it first within our borders of Nova Scotia, but certainly we're always open to working with people prior to them leaving the province for health care.
I recognize the Honourable Leader of the Official Opposition.
This wasn't the only failure. In 2025, she found out that her family members had the BRCA2 gene mutation that increases breast cancer risk to 56% for the sufferer. When she was referred to the IWK genetic clinic, she was told her wait would be 2 years for a screening to see if she carried the gene. So again, she had to leave the province and pay for private blood work in Ontario, where she tested positive. She waited months in Nova Scotia for a follow-up MRI before making the expensive decision to pay for a private MRI in Moncton. What does the minister expect women to do if they can't get care here and can't afford to pay for it in other provinces?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. And certainly we depend very heavily on our clinicians in order to assess and triage patients throughout the system. We do appreciate that there is a number of foundational investments that have been made. We have to not only in equipment but also in staffing. So we do work with clinicians to understand, number one, what the criteria are, if there's equipment that is required, do we have the folks to operate it, all of those different things. We've made foundational investments. We're now looking at ways in which we can improve the efficiency of these systems. We'll continue to do that work. We're committed to making sure that Nova Scotians have timely access to care. We know there's more to do, and we're committed to do that.
I recognize the Honourable Leader of the Official Opposition.
She was high risk. She had a 56% chance of carrying the gene and was told she had to wait 2 years. Cassidy's mom wrote to us because she felt compelled to share what she called examples of Nova Scotia Health's failure and disregard for female Nova Scotians. She writes, "If I was unable to pay for testing and treatment in other provinces and countries, my daughter would still be waiting for a diagnosis. I have provided clear examples of how women are treated, which I know is just a drop in the bucket. There are so many women in this province that have been disappointed and put at risk because of Nova Scotia Health." Those are her words. Will the minister explain to Heidi, Cassidy, and the thousands of women like them why 5 years into their commitment to fix healthcare, women have been so clearly left behind?
Please, before I move on, please table that. Oh, okay, perfect, thank you. I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. And certainly we have made a number of investments, as I've said, not only in equipment but also in staffing, which is essential. We can have all the equipment we want, but if we don't have a workforce to operate that equipment, then it really it's not helpful at all. There has been a number of investments, and I want women across and gender diverse folks across the province to know that. There's 2 new specialty clinics for endometriosis and chronic pain care. There's 13 new FTEs have been recruited to ambulatory gynae services across this province. We've looked at increasing things like the Deanne Reeve pelvic suite in order to encourage and make more efficient the care, not only for men but for women as well. We're looking at all of these different ways. The system is stretched. We understand that. We'll continue to work and make sure that people have access to the care they require.